So I run a concierge clinic, which is really quirky and fun. It's a fancy way of saying I run a cash-based practice. And the reason I do this is because when I used to work at a practice that was a wonderful practice, we accepted insurance. And what would happen is insurance companies would dictate how I would see my patients. An example would be if you had United Healthcare. We had to fill out paperwork, the patient and I, we'd have to submit it for approval, and oftentimes we might get 6 visits, which needed to be done in 3 weeks. For a post-op hip replacement and you just need like some things, maybe. But what if you're an ACL repair? What if you have osteoporosis? What if you're postpartum? What if you have nerve entrapment, chronic pain, a mystery illness, connective tissue disorders? Or what if you're a person who is chronically broken because your hormones hate you or your connective tissue hates you? Which is a lot of people. So then I would have to continue to see these people and we would run out of visits and then they would be charged these large amounts by their insurance company. And then we would try to appeal it and the patient felt bad and they were trying to do the right paperwork and nothing would get us the appeal. It was almost as if their main goal was just to deny us and we are a conservative care, but they would more readily approve a surgery, which would cost thousands of dollars more pain and injury to the patient. So fast forward to now, why I run my practice the way I do. I have the luxury of treating my patients one-on-one for an hour. Only me, only them. We work together to make a plan of care. Then they come back the next visit and tell me, did it work? Did it not work? I struggled to implement this. I hurt when I did that. How are we going to fix it? And we do. We modify. And it's kind of like a dance where we go back and forth. And it's a place of respect and healing because we were never meant to do this alone. So this is where the joke that I say I'm like a hairdresser for the body came in, because women know we have hairdressers. You either want your short hair cut short because you get in that weird phase, or you want your grays colored, or you want your highlights, or whatever it is. But we commit to hairdressers for like decades. So when I tell you some of my patients have been with me off and on for decades, I'm not kidding at all. I don't always see them all the time, but they'll come back to me when they need me if something's tweaked or something's hurt, or if their son has a problem, or their husband has a problem, or their daughter has a problem, or their mother has a problem, because I'm the person that takes care of them and their family. Now in Ohio, we're blessed to have what's called direct access, where people can walk in off the streets and see a physical therapist. We are a doctor of physical therapy. We have a doctoral degree. I personally have 3 degrees and multiple certifications. And I would dare say I am appropriately trained to take care of you. Now, with that being said, I don't really believe I work by myself. I work with a team of doctors, nurse practitioners, other healthcare providers. So we work nicely as a team. We are not an individual entity. I enjoy working with doctors to help my patients. I have the luxury of spending more time with my patient, hearing their words. Then I can follow up with their doctor and say, hey, did you hear them say this, whatever it was? And they'll be like, no, I didn't know that. I'm like, I think you should think about that and talk about that with their next visit, because I heard that and I think you're going to want to know it. So people do pay to see me, and I know that money is a luxury and not everyone has it. So things you see in my clinic that aren't really typical is it's kind of a pretty warm space, and I have beautiful views, lovely plants. I have my reformer, I have equipment. Hello. I have my Pilates chair. Yes, we actually do exercises on this rug or the tiny humans that come with my people. And my waiting room doesn't look like everybody else's. But what I tried to create in my clinic was a warm, safe space and a spa-like experience. Because I treat women who are broken, I wanted it to feel comfortable and a place that you could go and take a breath. So when my clinic opened, it opened February 14th, 2020. I don't know if any of y'all remember what that was like, but the lockdown started a month later. A month later. And my practice exploded. And I am beyond grateful for those people that helped me start my practice. And I am here to say 3 years later, my practice is exceptionally full. What has led me to TikTok is that I want to help more people, but I am physically so busy, I can't work any harder than what I'm doing. And like a glutton for punishment, I decided to keep doing research because I believe there are holes in our research and there are questions that need to be answered. And so, yeah. So if you like what I do, give me a like, give me a follow here, follow me on the other platforms, because just in case TikTok goes down, but I want to let you know that you are seen and there are lots of other people just like me. So I encourage you to find your person you connect with that helps you on your healing journey. You were never meant to do this alone, ever. Okay, bye friends.